And now, How Not to Die at Work, a Brenham ISD training guide for bloodborne pathogens. Meet Brenham teacher, Mrs. Smith. One day she hears a loud scream. A student's finger has been cut and is dripping blood. What is she to do? No worries, Miss Smith. Keep yourself and others healthy by following the guidelines for bloodborne pathogens. Learn about the definition, example of bloodborne diseases, and use of personal protection equipment, and the Brenham ISD emergency procedures. What is a bloodborne pathogen? Let's look it up. According to the Center of Disease Control, bloodborne pathogens are microorganisms such as viruses or bacteria that are carried in blood and cause diseases in people. What are some examples of bloodborne pathogens? No research is necessary, Miss Smith. We have some examples to show you. There are many different bloodborne pathogens, including malaria and syphilis, but hepatitis B and the human immunodeficiency virus, HIV, are the two diseases specifically addressed by the OSHA bloodborne pathogen standard. While there are several different types of hepatitis, hepatitis B is transmitted primarily through blood-to-blood contact. Hepatitis B initially causes inflammation of the liver, but it can lead to more serious conditions such as cirrhosis and liver cancer, and there is no cure. Hepatitis B viruses are very durable and can survive in dried blood for up to 7 days. For this reason, the virus is the primary concern for employees such as custodians who may come in contact with blood or potentially infectious materials in a non-first aid or medical care situation. The symptoms of hepatitis B are much like a mild flu. After exposure, it can take 1 to 9 months before symptoms become noticeable. Loss of appetite and stomach pain, for example, commonly appear within 1 to 3 months, but can occur as soon as 2 weeks after infection. As the disease continues to develop, jaundice, a distinct yellowing of the skin and eyes, and a darkened urine will often occur. How are you feeling, Miss Smith? If you are experiencing any of these symptoms after exposure to blood, consult your physician as soon as possible. The second bloodborne pathogen we need to review is AIDS. AIDS, or acquired immune deficiency syndrome, is caused by the virus called HIV. HIV attacks the body's immune system, weakening it so that it cannot fight other deadly diseases. AIDS is a fatal disease, and while treatment for it is improving, there is no known cure. Estimates suggest that an average of 50,000 people are infected every year in the U.S. Symptoms of HIV infection can vary, but often include weakness, fever, sore throat, nausea, weight loss, and swollen glands. The HIV virus is very fragile and will not survive very long outside of the human body. It is a primary concern to employees providing first aid or medical care in situations involving fresh blood or potentially infectious materials. It is estimated that the chances of contracting HIV in a workplace are only 0.4%. However, because it is such a devastating disease, all precautions must be taken to avoid exposure. Should Miss Smith be more concerned about hepatitis B or HIV? Both. Fresh blood contains both pathogens. But remember, dried blood can still transmit hepatitis. Still worried, Miss Smith? Relax. Knowing the pathways of transmission and how to reduce exposure will prevent illness. Transmission is most likely to occur because of accidental puncture from broken glass, blood-to-blood contact through broken or damaged skin, or blood contact through mucous membranes. Blood is the main concern, but other infectious fluids are semen, vaginal secretions, cerebrospinal fluid, pleural fluid, amniotic fluid, and saliva. Unbroken skin forms an impervious barrier against bloodborne pathogens. However, infected blood can either enter your system through open sores, cuts, abrasions, acne, any sort of damaged skin such as sunburn or blisters, any broken skin from glass or needle punctures. Bloodborne pathogens may also be transmitted through mucous membranes of the eyes, nose, mouth. For example, a splash of contaminated blood to your eye could result in transmission. It is extremely important to use personal protective equipment to protect yourself from bloodborne pathogens. Universal precautions is the name used to describe the prevention strategy in which all blood and potentially infectious materials are treated as if they were, in fact, infectious. In other words, whether or not you think the blood or fluid is infected with some bloodborne pathogen, you should treat it as if it is. This approach should be used in all situations. What personal protective equipment is most necessary? Gloves. Gloves can be made of latex, rubber, or whatever water-impervious material. If the glove is thin, double gloving can add another layer of protection. No, Miss Smith, a full body glove is not necessary, but if you know you have cuts or sores on your hands, you should cover these with bandages as an additional precaution before donning your gloves. If a glove is damaged, do not use it. When removing contaminated gloves, peel from the wrist, inside out, and dispose of them in a proper container. If gloves are not handy, you can improvise. Use a towel, plastic bag, or other barrier to help avoid direct contact. Professional custodial services should clean up all blood spills. Let's get back to Mrs. Smith's classroom. Since she knows the definition, example of diseases, and personal protection, Ms. Smith is ready to implement the Brenham ISD Blood Emergency Plan.